Speak Harmony, hosted by Sharon Thompson and Dr. Sharon Reid, bringing news, ideas, and community needs. We learn, we grow, we stay informed together in harmony. Our voices are heard. Speak Harmony, where knowledge meets community.
Where knowledge meets community. So we want to welcome you to another episode of the Speak Harmony podcast right here at APAT Media in Stone Mountain, Georgia. We're live on YouTube each Tuesday from 7 to 8 p.m. We would like to thank our sponsors, APAT Media, who we could say they do the most, but we're just going to put it in a nutshell. It's a photo and production full service media company specializing in podcasting, multi-camera recording, video and live streaming services, and many, many, many more. You may contact APAT Media at 470-657-1998. Again, that's 470-657-1998. Or you may email them at info@apapmedia.com. Again, it's info@apapmedia.com. We thank you, Mr. P and Damien, for keeping us beautiful, keeping us really shining right here at Speak Harmony at APAT Media. Thank you so much. So I'm Sharon Thompson, the host of Speak Harmony. You know who I am, right? And we've got such a powerful, let me tell you, get ready. Tell a friend to tell a friend. Spread the word, because what is about to happen is life-changing, Sharon. So we're going to get into it. What's going on?
So Dr. Sharon Reid, known as the Heart Lady, here with you, the co-host with Speak Harmony. So what's going on for the weekend? What did you do this week?
You know what? This weekend was a different kind of weekend.
Sad
but
for
you
you.
know, yeah, but you know what? We celebrated Mom, and so we got together with our friends, and that's what we have to do. We have to be there for our friends and family.
Yeah.
Take care of our loved ones and love on them. So it was a reunion of sorts, and it was just the way, just paying tribute to a distinct lady, a distinguished lady of honor.
Yeah.
You know, when I tell you, I mean, the life she led, really.
Yeah.
And the ones that she produced, her daughters, her grandchildren, or you know, so it just tells the stories.
Yeah.
So
you learn a lot when people pass, even more. You think you know them until you hear
the
and
stories,
then it's like,
you're
what?
Like, wow.
Yeah,
So,
absolutely.
So she was a woman of
yes,
stature.
condolences.
Yes, thanks.
Absolutely.
How about you?
And for me, my kids, my children, my adult children, they are the ones. We went to eat out to Soul Veg or Soul Vegetarian over there in the noted West End, because they're closing after 47 years.
Wow.
They are closing. So they remember that when they were little, when we just moved, it was one of the staple places because they didn't have a lot of vegetarian, vegan food. And so that was the first place we visited as a family. And so they said, hey, let's get together. And so we did. All of us came except for one of my sons who was gallivanting in Lisbon, Portugal. But he joined us via FaceTime. So we had a great time on that and just going down memory lane.
Wow. And I know you have exciting stuff to share about the day because, man, do we have a lineup? Do we have a lineup?
We have a lineup. It's, as you know, I've been giving the National Day.
Yes.
And so I started giving the day after so that you can prepare. So on 6:30, which is tomorrow, National...
Oh, tomorrow's the 1st.
Oh, gosh. Well, I did it today. No, no, it's 7/1. It is 7/1, yeah.
Yes.
Across the United States, postal workers walk an average of 4 to 8 miles carrying a full load of letters and packages, delivering them to each doorstep. That was back in the day, I guess. Some still walk, some drive. And, you know, these... Thank goodness for postal workers.
Absolutely.
You know?
Yes.
It is just to get our mail, to get our bills that we may not like, but it's a part of life. All right.
It is.
And for, you know, we don't get handwritten letters as much as we used to. I look forward to my little birthday cards that people still remember to send and businesses still remember to send. So, you know, if you see your postal worker, tell them thank them
you.
for their work.
Yay.
And also, so let me ask you, Sharon, if you were to make up any flavor of ice cream, what would that be?
Ice cream. Wow.
Make up your own flavor of your
Make up my own flavor.
Yeah, what would you
I would
put
probably
together?
do so that's probably more sorbet than a ice cream.
I love sorbet.
So I like sorbet a lot.
Yeah.
So I don't know, ice cream. I don't know. I would have to experiment with that because I can't even think of it. But sorbet, I would say a fruit punch sorbet.
Fruit punch first. Okay.
Yes, so I would
all
do
right,
like,
citrus.
I'd do like the mango, banana, strawberry, that kind of fruit punch. Yeah.
Yeah,
How
and I
about
like I like anything with a lemon citrus flavor, and I love sorbet or gelato. Yeah,
That's it,
So,
yes.
but so I asked that because tomorrow will be National Creative Ice Cream Flavors Day,
Interesting. Ooh, those are pretty.
and so there are so many different flavors, and there are over 725 businesses that make ice cream in the U.S. Imagine tasting 725. So go treat yourself tomorrow in celebration of creative ice cream flavors. And why don't you pick something that you've never tried before?
I like that.
All right.
I like that.
And to top off this segment, it is History of Be Nice to New Jersey Week. Now, I said, what? I didn't know that New Jersey had a bad rap and people talk bad about New Jersey. I never heard it. But I was there recently. It is truly the Garden State.
It is.
Going to the different farmers markets. So there was this author in Texas who decided that in 1985 that Jersey was getting a bad rap, and she said, well, I'm going to suggest we have a day to reverse all the New Jersey jokes and,
Wow.
hey, and celebrate. It has 42 acres of park, over botanical gardens. This is probably why it was called the Garden State, because it has nearly 300, it has a 300 massive botanical garden. And high waterfalls and so forth. So if you get the opportunity, see the best parts. It even has beaches, and I told you the last time, it has the world's #1 largest Hindu temple. Really fascinating to look at. So that's it for the National Day.
Wow.
But we're going to declare this a National Day because we have a guest who I
my
say is a
goodness.
big time celebrity. Tell us about it, Sharon.
Oh, my goodness. And we've been waiting, guys, and for what you all are about to get a treat of this amazing gentleman. We met him not too long ago at our state capitol where he presented. We were so impressed. We were like, we're not leaving this place until we are connected. And let me tell you, humility is just his thing.
Yes.
Because if you just to be in his presence speaks volume.
Yeah.
But he's such a humble servant of the people.
Yeah.
And so he's none other than Dr. Foluso Fakorede. When I tell you he's an international cardiologist, limb preservation specialist, a nationally recognized health equity and leader who has redefined what is possible in one of America's most underserved regions. He's the founder and chief executive officer of Cardiovascular Solutions of Central Mississippi. He made an uncommon and deliberate choice to move, unrecruited, by the way, and let me repeat that, unrecruited, to the Mississippi Delta, a region identified by American Heart Association data as one of the nation's most severe cardiovascular deserts, with among the highest amputation rates by congressional district. Shame on you, America. Shame on you. But you know what? God bless you, Dr. Fakorede. God bless you. Let me tell you, he has dedicated his life to service. And so we want to applaud you, sir. So he was born in Nigeria, yay. Born in Nigeria, raised in the United States. Dr. Fakorede earned his medical degree from Rutgers Robert Wood Johnson Medical School and completed his internal medicine training at New York Presbyterian and Cornell Medical Center. He subsequently completed advanced fellowships in cardiology, interventional, cardiology. Mm-hmm. He has done the whole 9 yards. His work, Dr. Sharon, mm-hmm. has reached far beyond the bedside. In 2024, Dr. Fakorede was the subject of the internationally recognized documentary Bloodlines, Mississippi, produced in collaboration with the Nobel Prize Outreach and Grain Media. Mm. He has done so much to fight this evil disease. But when I tell you he's got accolades to fill the studio.
Yes.
But I'm not going to bore you with it, because if you want to know more, look him up, because there's a documentary that you need to see. I mean, you've got to, guys, don't let me bore you with it. AC Newsflash featuring Dr. Fakorede. Look it up, okay? Because it's the Amputee Coalition, YouTube. But Dr. Fakorede, we want to say welcome to the APAP Media Speak Harmony podcast. We thank you for taking time out of your crazy, hectic schedule to be here with us. We're blessed because of you. Thank you so much, sir.
Good evening, family. How are you? And I am honored and privileged to be here with both you, Ms. Sharon and Dr. Sharon. I first want to thank you for the privilege of invitation. I thank you for that wonderful introduction. I thank you for the information about my state, home state, New Jersey, which is where
I did not know that.
Wow.
So right on time.
It's fitting that you have a representative. Be nice to us, please. There are a lot of great things that come out of New Jersey, contrary to popular belief. And also, I love ice cream and butter pecan versus, I don't know, something.
If you were to make up one, what would it be?
I don't know. That's a great question. I try to keep it simple, kind of KISS kind of philosophy. With
Yes.
But something with butter pecan will probably be involved, and then we'll take it from there. I mean, I don't know. Salty caramel is another option, but I'll leave it to the inquisitive minds to kind of add.
I like that. I like that, because butter pecan, believe it, I love it.
Yeah, love that. But just wanted to thank you for having me and having the time to discuss about not only the community I serve and I treat, but also the why of the mission and how a crazy guy from New Jersey ended up in the heart of the Mississippi Delta.
Yes, we'd love to hear that story. So how did that crazy guy end up in Mississippi of all places? Why Mississippi?
Why not Mississippi? How about that?
Okay.
Right?
How about
Why
that?
not Mississippi? Largest proportion of black residents is here in Mississippi. 3 million people live in Mississippi, 40% of whom are black. Majority are here in the Mississippi Delta. You see all the statistics when you look at the heart and vascular maps in terms of heat maps. Where's the highest heart disease rates, high blood pressure rates, heart attack rates, amputation rates? Lowest number of numbers for in terms of highest infant mortality rates, lowest number of physicians per capita. Everything is the Mississippi Delta. But where are the specialists? Where's access to quality? Where is access to quality foods? Where is the best social determinants of health? Not Mississippi. So when you put those maps together, you kind of see where there's a need and there's a historical context to this. And so when I went through my medical training, I kept on seeing these repetitive maps, and I didn't know at some point that there will be my mission, my vocation, my passion, my calling by the man above to come and serve his people. I didn't know that there'll be some intersectionality, but I really credit how I ended up here. I credit my mom and my parents, because growing up in Nigeria, I was born in Nigeria. In Africa, I came here when I was 13, and a lot of Mississippi reminds me of there. There's underserved, a lack of access in certain areas, and you look at the social determinants of health that plague that region. But the will of the people are still there. The historical context, the power of the historical context of what Mississippi has contributed to the history of this country, and places like Africa have contributed to the whole diaspora in general, and how that has sprung into why we all can commence here this evening. That is powerful. But my mom left Nigeria because she wanted us to have a better education. She wanted us to have better access to more options in terms of our long-term goals. I knew I wanted to be a heart specialist at a young age. Yeah. And so she came to America, and then she worked hard and brought her kids over. And so I learned about not only early life medicines, but also how medicine is a way in which you have the tools in your toolbox to not only heal, to do good, to be compassionate, but to leave a legacy tree along the way, to serve those who lack a megaphone. And so she gave me that idea, and medicine kind of put that together for me in terms of giving me an outlet. And so through my training, I got the best training, got the best schooling. What do you want to do with that in terms of your calling? And that's when God came in and said, "Hey, listen, your mission is not ending in New Jersey. I'm sending you to the Mississippi Delta." And it was one of the craziest decisions I made, unrecruited. I saw the maps. I knew I wanted to do limb salvage early on, which was actually one of my weakest subject points in residency and training. I became a strength. So that's another topic,
That is another topic, but a very great testimony.
Yeah. And I had the fear of public speaking at the time. So that all culminated into ending up saying, hey, I wanted to start my practice in where the highest amputation rates were, where the highest heart attack rates were, where the people look like me, and wanted to come here and represent them in a manner that would bring a positive light to the Mississippi Delta, because everything had been negative from that standpoint. So I wanted to change that trajectory and bring something positive. And that's why I decided to come here 10 years ago.
Well, they give thanks for that.
Yes.
Yeah.
Oh, absolutely. Oh, it says here, Janet is on line, Dr. Fakorede, saying, good evening, all. Very impressive resume, Dr. Fakorede.
Oh, yes.
Yes. And that's only scratching the surface. And I'm saying, no, take it, because you know what? You're such a humble person. When we saw you at that state capitol, it never left my head. I got home. I was so excited going home. Just thinking about what you shared, the snippet for that short period of time that you shared with us at the state capitol.
Yep.
What you delivered left such a remarkable, embedded memory for me. I kept telling everyone about this guy. I'm like, you've got to go research and you've got to go check him out, because you know what? You're a servant. You were sent. You were called. That's your calling. And thank God for your mother your parents to have identified that. And, nothing like a mom to push you in that direction, in the right direction. So that's your why.
Yeah.
But can I just pause for a moment and ask you this quick question? Now, mentoring, because there's so many young men and women out there that look like us, and they're looking they're trying to decide. They're in med school and they're deciding, should I go here or should I go there? Is there a space for them, especially in Mississippi, in the Delta? Because I've seen stuff about the Delta that broke my heart many moons ago. And I kept saying, what can I do from where I sit? So I thank you for being the megaphone in that area. But is there a mentoring program, even for those folks that are, not afforded the opportunity over there in the Delta or even close by? How would you send them, in that direction?
That's a great question. We have been the model for that in terms of trying to make people be what they can. You can't be what you can't see. So until they come here and experience that and see you in person, and see the vision of what you've built and see how it manifests in the day-to-day lives of patients that you treat who are now family members.
Yes.
That is where you manifest that energy. So what we've done over the past, years since I started, was I took pride in the fact that we could reach out to all the high schools. So any students that are interested in sciences here in the high school, we actually attend all their health fairs and then they come and shadow. We have a rotating actually schedule where students some who are not even interested in sciences, but might be interested in some of the other aspects of, is it a nurse, a medical assistant, one of my techs? Is it someone who wants to be an administrator, someone who wants to be an intake coordinator at some point, social worker? Just giving them access to the healthcare environment to see, okay, where can I fit in? And then that's why we bring them to our clinic and they see what we do every day. In addition to that, we have students and also trainees from other states who want to learn how to do limb preservation work, which is what I do. We'll get into that later. And so New Jersey actually is the first where I trained. My alma mater sends 2 fellows every year that come and shadow me for a couple of weeks, and we put them up and they come in and train and learn how to run a practice in a rural area, how to do community engagement, how to go in and save someone's limbs, how to go talk to them in the clinic, how to go out and engage in the community, and take that back home to New Jersey, to a metropolitan area.
Yeah.
So that is the way to do it, and hopefully the goal is to hopefully one day expand this footprint where there'll be more Dr. Fakorede is here, and that will be the norm rather than being the unicorn, right? We want that to be the norm. It's not
Close
just
up
here.
that gap. Yeah.
Yes, the lack of access across the spectrum in a lot of rural communities. If you look at access to quality care from the cardiovascular spectrum, the mortality from preventable deaths in the Black community, that gap is actually widening. For the white community, it's short, but for the white community, it's actually widened over the last couple of years. And so concordance matters in our who your doctor is, who your physician and provider is, what they look like. Do they understand your culture? Are they competent?
Yeah.
How do we address some of the conscious, unconscious biases that we see?
Yeah.
And let's call it for what it is: racism in healthcare. So how do we combat all these things? It's multifactorial and it's deep, but it's rooted in the systems. So we have to understand the systems, and for us to understand the systems, we have to have people come in and learn what the systems entail. And so I have been privileged to do that and understand where the intersectionality of not only the clinical, the policy, the advocacy, the community engagement, the educational awareness pieces, and also volunteering your time to mentor is very important. Help nurture that growth of the future generation to end the generational scar.
Thank you so much for that, because you have definitely built a system of care there, very comprehensive and community-centered. And I have to say again, when you talk about limb preservation, I have to toot his horn, because this is 88% reduction in major amputations.
Oh, gosh.
4 years.
Oh, yeah.
4 years.
Yes.
I mean, that is big.
It is.
That is really, really big.
And I need to opine on that, because it is shocking that someone can come and implement a system. But imagine if the Doctors Without Borders system was the Doctors Within Borders system, where we mandated our trainees or medical students or anyone in the healthcare system, our nurses, our future physical therapists, to come and work in rural settings across the country, Black neighborhoods, brown neighborhoods, Native American. I mean, it's just and go to the reservations and to see how things work, the Hispanic community, to understand, okay, let me engage and entrench myself here for a year.
Yeah.
And let me see what impact I can do. If it were a predominantly diabetic community, how can I help improve their sugar levels or their hemoglobin A1Cs for a year?
Yeah. Yeah.
What can I do? What projects can I do? And imagine if the government incentivizes that approach.
Yes.
Right?
Yeah.
And then let's do that for high blood pressure. How can I decrease the blood pressure? How can I improve compliance? How can I engage the civic organizations to help me in my outreach? How can I be a better community navigator? Right? And how can I improve the cholesterol numbers? How can I decrease the heart attack rates, cancer rates? How can I get improvements in my research outcomes? If you can do that and incentivize that piece,
Yeah.
I think from a policy standpoint, we need to start looking at the doctors within borders and look at where are the heat maps like the Mississippi Delta, and how can we send our bright minds, the young ones in there with mentorship. The mentorship does not necessarily have to be at the ground 24/7. You can have a big academic center that can serve as a mentor hub and hub and spoke model, right? Like, where rotating doctors can come and help out and then go back to the main centric area. So these are things that we need to be more disruptive from a positive standpoint in creating in these rural areas and these vascular deserts, cardiovascular deserts, as I call them.
So, you really speak to my heart, because that is one of the things that I think about is prevention, and talking about, Sharon, in those rural areas, really having them to educate them. One of my dreams was, and still is, going in those, I teach CPR and first aid, and a lot of this could be so preventable if they understood and recognized signs and symptoms of cardiovascular disease. And the symptoms of hypertension, hypoglycemia. That has been my heart.
It takes 90 minutes for an ambulance to get to someone.
90 minutes
in America.
Yes, let me say this fact. This is rural America. This is data. But if you were to live in rural America, and rural, this is the most rural state. Most hubs in terms of urgent care centers and ambulance centers, you have to understand, they serve a wide community. So once you call 911, there is a possibility you're not seeing an ambulance arrive to your doorstep for about 40 to 60 minutes. If you live within a city, that's different.
Yeah.
You're right. But remember, the rurality, these are people who live in catchment areas of 3,000, 5,000, and you have to drive an hour to these areas, sometimes 45 minutes. And you have to use back roads, and your GPS ain't going to get you to that front door. Wow. So by the time you get lost and you find this place, you're talking about 40 minutes, 45 minutes. CPR is the number one thing that every single American must learn, because we know time is brain muscle. And after that 5 minutes, for every 10 minutes, every 10%, you lose it. Every minute, you lose 10% of your brain muscle. So that 8 minutes is critical. 8 to 10. So you want to get to them to know how to do CPR, and I totally commend you for bringing that up, because that's the first thing we do train our community engagement outreach programs on is CPR hands-on. Because that is the matter of life and death, especially if we're trying to keep the young people in the working population. Yes.
And it's from anyone who can do it, Sharon, who can do it. And we're talking about what to do in those precious minutes while we're waiting for emergency care.
Correct.
So
but
thank you for that.
Of course. But you know what? And I'm glad you said that. But here's another thing. So the reason you were one of the reasons, Dr. Fakorede, that you were at the state capitol was to bring awareness. And so what we have to do as a community, as a people, just like we go to church, we send our children to school, we've got to go back to basics. I can't stress that enough. We've got to go back to basics. We can't wait until something happens and be reactive. We have to be proactive. So learning starts within the household. And for those, there's a huge disparity. But you know what? For those that know, we've got to teach. We've got to share. We can't wait. I hear parents say stuff like, the teachers are not teaching. And I just want to scream and kick and scream and kick and scream again and say, listen, guys, parents, you're not teaching. You're the first book that your children read. Stop waiting for teachers to teach them. If you can't do that yourself, get outside your house and go get someone who can do it, who's capable of doing it. We, especially not in the Mississippi Delta, but certainly even where we are, there are places, in other words, there's no excuse. These gadgets that we have, these things are learning machines. But what we do, we play, and I'm not knocking the games that we play, the whatever they call them, I don't even know them. But we play games on these things, but we need to educate. We need to use this for the upliftment, for the edification. And so it would make sense to do a CPR course. I mean, a family, for example, instead of going to the park, do this in the summertime. Sign up for a CPR course for the family. Do a family event of it.
Yeah.
So these are the things that we have to do. We cannot wait on the government to do stuff for us.
Yeah.
And it sounds preachy, but I'm saying it because we need to. We cannot wait on the president. We cannot wait on the governor. We can't wait for the mayor, any politician. We've got to take the bull by the horn.
Yep.
So we're just about wrapping up this first segment, but there's some questions. Our producer is saying that there are people online. There's some questions that they're asking. They want to share with us, so people are tuning in. And we thank you so much for coming in. It says, thank you for seeing the tremendous need in the Mississippi Delta and choosing that area to serve. One of our amazing listeners, Janet, we thank you for joining us. Thank you, Dr. Fakorede, she says. Thank you for your service.
Thank you.
Wow. Charmaine says, thank you for caring. Yes.
And that is the key. Because that's what really, he could have been making a lot more money up north, but he went to Mississippi where he saw the need. So that shows care.
It does. And Charmaine says, impressive, informed patient. Wow. Because Charmaine lost, her husband. She lost her husband to heart disease recently. And the disparity, she says, in healthcare when it comes to Black neighborhoods, patients are not given options, and some of these may not have been necessary. That is so true, Charmaine.
Yeah.
So
someone said,
ice cream too. But yeah,
you know that's an island girl, right, Doctor? Doc? That's, yeah.
Some
Bamba. Yeah, we're Afro-Caribbeans. We can't go wrong with mango. We love our
mango. Mango or coconut, we're all in there.
We're all in there. So we're going to take a break, guys.
Yeah, when we come back, we'd love to talk more about PAD, the peripheral artery and limb amputation. All right, y'all stay tuned.
Yes.
This episode is brought to you by our sponsor, APAP Media Group. APAP Media Group is a full-service creative video and photo production company specializing in podcasting, multi-camera recording, and live streaming. Contact them by email at info@apapmedia.com. That's info@apapmedia.com. Thank you to our sponsor, APAP Media Group.
Welcome back. And this weekend, let me tell you, it's 4th of July coming up, right? So this weekend is kind of, the barbecues, the whatever stuff they got going on. But there's an event that's coming up that we have to shout out. So CYA, that's CYA, Leadership Consulting presents a picnic and painting in pink pajamas. You heard it right. Picnic and painting in pink pajamas. It's an exclusive and private business networking just for our group. And Charmaine, is one of our amazing listeners, our supporters. On Thursday, July 9th from 6 p.m. to 9 p.m. Where's this being held? Painting with a Twist. And that's at 178 Krogan Street. And that's Suite 230 in Lawrenceville, Georgia. Okay, that's all. It's $45, ladies and gents. And so it's $45. And I think this is, it's $45. Get out. It's really not that much. So you can contact Charmaine at 678-891-9859. Again, that's for the picnic and painting in pink pajamas. And we have another event to announce. It's the Jamaica's Scholarship Independence Ball, our annual Independence Ball on August 8th this year. And guess what, guys? It's going to be right down the street in Stone Mountain Park at the Evergreen Resort. And we have none other than our very own Sonia Richards-Ross, our keynote speaker for the evening. Ladies and gents, you don't want to miss it. Today is the day that you get your early bird tickets, because starting tomorrow, it goes up by $10. So you have up until midnight-ish to get your tickets for this ball. August 8th, put it on your calendar. You're going to thank me later. Thank you so much. And welcome back, Dr. Fakorede. Man, let me tell you, what an amazing gift you are to us. We thank you again. Wow.
Yes. We
Let's
were talking earlier about prevention, right? And I'd like to know a little bit more, what do people need to know about preventing amputation? Because that seems to be a big passion and part of the center of what you do.
Yes. So, every 30 seconds in this world, a person loses a limb from peripheral arterial disease and diabetes. In this country, if you are Black, you are 3 to 4 times more likely to lose your leg. You are also almost two times likely to have peripheral artery. The prevalence is almost twice as high, 30% in the Black population versus 19% in the white population when it comes to peripheral artery disease, which is basically the narrowing of blood flow to any blood vessel outside of the heart, particularly in the lower legs and in your limbs. And if that is not identified on time, or by screening, or by symptoms, or by some type of tool, it can lead to basically lack of blood circulation to the muscle, and the muscle starts dying. And manifestation of a dying muscle, which I call a leg attack, is like a wound, an ulcer, or your leg turning darker, and in some places red. It's cold. You can't feel a pulse. It's heavy. You feel like the leg gives out on you all the time. Those are some of the manifestations. Your hair growth stops growing, and the nails start looking funky, and fungal infections start kicking in, and dry skin, and it starts getting unhealthier. And if you don't treat that too on time, then you start getting to a point where almost about 76% are offered an amputation first strategy rather than a limb preservation first strategy. And so peripheral arterial disease is a very common and prevalent, affects about 21 million Americans. Most of these folks, if not treated on time, will die at a rate that is worse than all cancers combined, except for advanced lung cancer and pancreatic cancer.
Wow.
So the death rate from peripheral arterial disease at its advanced stage is worse than any other cancers that you can think of in terms of the 5-year mortality, except for those 2 cancers I mentioned. In addition, it's very costly. It costs our healthcare system billions of dollars every year, over close to about $20 billion a year, so as high as 40. And if you look at what percentage of these amputations that occur, there are about 200,000 amputations every year. 160,000 occur in diabetic populations, which predominantly affects our population. And most of them occur fast, furious, without being screened. A lot of primary care doctors, and this is the key, the gatekeepers, the people who see patients like you and I every day, are not well taught about peripheral arterial disease in their medical training, nor are they incentivized to screen. So that's the gap. I don't get well taught, and I become a doctor, and I'm practicing. Hospital, private practice, doesn't matter. But I don't know the topic well versed enough to know what to do. I don't identify it early. And once I identified, who do I send it to? Who's my referral pathway? Do I send it to Dr. Fakorede, who I think is a cardiologist, and not knowing that I trained in vascular health, right? Or do I find a vascular surgeon, or do I find an interventional radiologist? Or do I send it to a general surgeon, orthopedic surgeon, right? What are the training modalities for people who actually know and how to treat these conditions? And then lastly is, what happens in terms of the treatment options once they are identified, right? We talk about primordial prevention, primary prevention. I want to prevent the risk factors. What are those risk factors? Diabetes, high blood pressure, high cholesterol, any type of nicotine use. Do I smoke? Do I chew? Do I vape tobacco? It's not just do I smoke, do I dip, do I chew? A lot of people in the South, that's a very common thing that we don't screen. It's how you identify these patients. And then also, do I have a family history? Have I had a heart disease where I had heart blockage, but then the doctors didn't check my pulse on my feet to see if I have leg disease. I've had a heart attack. Did I have a leg attack? I had a stroke. 40% of patients who've had a stroke will have peripheral arterial disease. 60% who've had heart disease will have peripheral arterial disease.
Really?
So it's basically understanding who's at risk. And then lastly is age. Anyone over the age of either 50 with the history of diabetes and other risk factors for a couple of years, or anyone over the age who's a Medicare recipient. 1 in 5 will have peripheral arterial disease. And so what are the things that you should know is when you go see your doctor and you have any of these risk factors, tell them to take off your socks and check your pulse. The heart beats and pumps liters of blood, almost 7 liters of blood down your feet and back up to your heart. It has to go up and down in 16 seconds. Well, your feet is a good place to check a pulse and see if that pulse is strong. Right? That's the way to see what's going on with the heart, what's the circulation. And if it's diminished, well, you might have something blocking it upstream. So that's why we tell people take off your socks when you go see your doctor. Let them inspect your feet. Doctor, check me for poor circulation. I do not want to lose my feet. That's good. And if that doctor doesn't know how to do it, request for a second opinion. There's someone else who can find me a doctor that knows how to check for circulation. And once you do that, there's a test that's done. It's called an ankle brachial index test. That's basically a blood pressure cuff that's put on your ankle and your arm. They take a ratio of it, and that ratio will determine if it's normal or not. There's a specific range that it should be. And that's something that's not being offered in primary care doctors' offices because the U.S. Preventative Service Task Force that controls basically everything they do and incentivizes if Medicare will cover this or not, has really yet to make a decision yet based on data that, hey, we don't know if we want to do this or not. Although we know that Black patients are disproportionately affected.
Ridiculous.
The lack of endorsing the screening will precipitate disparities in treatments and outcomes and lead to worsening amputation rates. Their words, not mine, verbatim. But we still need evidence and data to show more things. Well, guess what, U.S. Preventive Service Task Force? Little hint. Most of the data that you see in the heart and vascular space were not done on people like any three of us here on the panel. Most were done on white patients. Okay? Only less than 5% of Black people have been enrolled in clinical trials to date in the cardiovascular space. So what data are you looking for? Before they got on the hill in terms of being off that cliff and being amputated? Or is it the data that, hey, listen, we want to see how screening will prevent? If I just told you that the death rate from this is worse than cancers and we're screening for all cancers, but we're not finding out. Don't get me started.
Oh, see?
Get started.
Go ahead. You listen.
What we do is we go back to how we got screening in the first place, policy. And that's why policy is important. We go to the policymakers and say, do you want to spend $150 billion a year on amputations or $150 million on screening and saving a whole generation, including a workforce, that will now improve not only your outcomes from a productivity standpoint, from less money spent on down the hill or off the cliff amputations that you spend billions of dollars. To save a leg is about $30,000. To amputate a leg, you're talking about close to about, $800,000 or more. Not to mention, 80% of those patients will be dead within 5 years. So what's the cost to the patient, the family, the community, and to the generations of that person? So you make it an economic point, you make it a clinical point, you make it a humanistic point. You have to use some point to make sure to let these people know that this is a preventable epidemic. 80 to 90% of it is preventable.
Wow.
And can be treated. And how I found out was because I am a revascularization expert, meaning that I'm someone that if you have clogged arteries or pipes, you call me and I unclog the artery in your heart or in your legs. Well, how many people are given an option to open up their blood circulation in their legs? We found out that only less than 25% are offered a revascularization before an amputation is offered. Most people are given a primary chop. Let's amputate first and we ask questions later. Predominantly Black patients. If you put Dr. Fakorede with just, someone who is in rural America who's poor, very poor, median income $30,000 a year, and Dr. Fakorede, a cardiologist, and you put both of us, Black and white, in the same hospital, I am still 3 times more likely to be offered an amputation first strategy than that poor white patient. Why?
Yeah.
Well, Dr. Fakorede, I have a shout out, and I've heard from you started, all I could hear is advocates, 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 because there's so many people who need a megaphone, and I thank you for that permission. You don't know, I'm taking copious notes, Dr. Fakorede.
Yeah.
There are people out there who need a megaphone. And this is what Speak Harmony does. This podcast is doing just that, being a megaphone for those who don't have one. But I thank you, and I want to shout out Representative Doreen Carter, because if it had not been for her advocacy, we would not have been at the state capitol to meet the likes of the great Dr. Fakorede. So you know what? Our life has been enriched because of her doing what she does. And this is what happens. We talk about preventative, but we are, as a people, we're more reactive than proactive, because we're cutting corners, because we have to be balancing budgets. We're the best budget balancers in our households, because we have to think of paying this bill as opposed to going to the doctor.
Yeah.
And so that's what it is.
Yeah.
We're just not having availability. And a lot of times, speak to that, Dr. Fakorede, because as far as these diseases are concerned, America, you're not waking up and keeping your people healthy. Shame on you, because there are enough to go around, food to go around, for example. There's enough stuff for us to all eat and be healthy. Whatever health looks like. We have enough right here in this country. Shame on you, America, to have the sickness and stuff.
We need a true healthcare system, not a sick care system.
Not a sick care.
One that, like, as you mentioned earlier, I think, Dr. Sharon, you mentioned, primary prevention is at the core. Primordial prevention, which is basically what's the diet and exercise looking like? What's that high blood pressure and high cholesterol control looking like? What's that diabetes control or nicotine cessation control looking like? And then secondary prevention is that primary prevention plus, do you have access to all these great medicines that are coming out that have been shown to make you live longer, keep your limbs on, right? Do our patients in rural America have access to them? Can they afford them? Affordability of medication, right? And then the third is, do they have access to the specialists that are known to save them if they were to get in trouble on that cliff or up and off that cliff, as we mentioned? And so why are there medical deserts, vascular deserts in our communities? Why are the social determinants of health that lead to primary prevention being, at the peak, or primordial prevention, why are they missing in our neighborhoods? Why do we have the worst metrics? Those are the things. Why are sidewalks missing, right? Access to quality foods missing. And so, for me, it's putting all the pieces together, coming here, getting the right people in the room, getting the right specialists in the room, and putting that together with our community outreach, inform to transform, teach them what PAD is, teach them what that heart attack is, teach them what high blood pressure is, diabetes is, and letting them know the impact, not only clinical, economical, human, but generational. How does this affect my kids? That mindset has to change. I have to go to schools to teach young kids how to teach their grandparents how to eat better. Because they are the primary caretakers of their grandparents.
That's right. And they buy the food.
On the football field, will go to practice. Some of them to just get a meal during the day, to be honest, play football and go home to take care of grandma who's on insulin. So that is a point to capture them. So there are a lot of things that we have to change in terms of not only how we target, in terms of our outreach, but who we target, the ages in which we target. We're having a younger diabetic population, obese population. We need to get that under control.
Yes, control.
We have to make sure that our elderly, our Medicare recipients have access to quality medications. We have to make sure that all those people who are living in that disparity spectrum in terms of, women, why are they ignored when they go to the emergency room with chest pain or leg pain? It's, you know what? It's the church stressing you, or it's the dog stressing you, or your daughter stressing you. No, it could be a heart attack. It could be a leg attack. It's not the gout, as they say in the South. The gouge.
The gout.
No, it's not gout. It's peripheral arterial disease. That wound or ulcer that's not being healed.
Yeah.
Who can I send you to help you heal this wound? Have we talked about all the elements that go into healing a wound, and what foot doctor should you see, and what shoes should you wear or avoid, or what type of agents should be used or not utilized? So these are the things that most people just don't know. You don't know what you don't know, and you can be what you can't see. So we have opportunities at primary prevention, primordial prevention, secondary prevention, amputation prevention at different columns that we can target. And that's where we found that, doing this early on, screening, advocacy, primary prevention, getting them timely referrals to get their procedures done, making sure they have access to their medications, all led to that gumbo of decreasing amputation rates in a timely fashion over a 4-year period.
Yeah. Well, thank you for
Two
that
things,
because,
yes.
I teach a lot of CPR to healthcare providers, to a lot of nurses, and I am going to make sure that I talk about that because I don't talk about PAD.
Take your socks off.
Yeah, and making sure, because I also
yes.
help support nurse practitioners that come into the internal medicine office, and those are the things that I'm going to make sure they're screening. I had 2 quick questions, Sharon, Dr. Fakorede. What does screening look like? Is that an expensive thing? What does screening look like?
Yeah,
and the other thing is, before you answer that, this is a quick question. I teach a lot of my clients to do toe heel, to keep that the blood moving, especially for those who have diabetes and high blood pressure. Is that okay does that really help?
Absolutely. And I'll start with the bladder. Any type of exercise that leads to movement, whatever it is, 30 to 40 minutes, I don't care what it is. It could be in a pool, aquatics, or on surface, or just even if you're walking in your Walmart, but intentionally saying, okay, I'm not shopping now, I'm just going to do a couple of laps.
Right.
That is improving your circulatory flow. Okay. And the more you do, the better, right? What does screening look like? Screening is very important. If you have those risk factors, meaning that if I'm over the age of 65 or I'm between 50 to 65, but I've had diabetes, nicotine use, high blood pressure, high cholesterol, family history, or if I'm less than 50 and I've had diabetes for like 10 years, and then I was recently diagnosed with hypertension or kidney disease, right? Or I've known history of plaque buildup anywhere above the belly button. Because I tell people plaque buildup doesn't stop below the level of the belly button. So anywhere above the belly button, your heart or your neck, you should be screened. And what does that look like? It's an ABI, which is the ankle brachial index that costs less than $100, to be honest. That is something that any office can obtain, and that's something that can be done. But if you do not have the time to screen and you take off a patient's socks and you check their pulses and it's diminished, you know what you can do? You can refer them for a vascular evaluation with an expert, right? Even if you don't have the time in your office or the tools in your toolbox. Because if that ABI or TBI, there's another one called the toe brachial index. They're different levels because the ABI might not be as good in someone who has calcified vessels, meaning it's not compressible. If you're a woman, sometimes as you get older, that's a problem. You lose estrogen, and that becomes an issue. Nicotine users as well. You can use a TBI, which is a toe brachial index, rather than the ankle. The brachial, they'll use the toe. The ankle, sorry, they use the toe. And then you can use other non-invasive studies are out there, but you need to refer them to a vascular specialist to do that testing. That screening is very important. Because once you screen, you can then start them on medicines early on that have been shown to decrease progression of disease, and also it prevents the worst, which are wounds, ulcers, and amputations.
Wow.
And so between medicines and exercise, that's something that is great.
So one of our guests are saying, what happens unfortunately, her comment is what happens unfortunately is that there are many people who do not have health insurance, and sometimes the health providers will not attend to these folks. But I will also add that that is unfortunate. That is very unfortunate. But we also have the flip side of that, because there are people who would buy 4 lattes per month. And I'm going there because, they'll go to Starbucks and they'll buy 4 frappes or lattes or whatever they call it, right, per month. And to spend that $100, to go take your socks off and go to a vascular specialist or whomever just to check to make sure, because there's diabetes in the family.
So my comment to those who don't have insurance is walk into that office and see, is there a plan I can either get on that you can work with me, or two, call my office, because one thing that we do here, and that's why I built my outpatient base, I built my own center. I've never asked the patient if they don't have insurance no, we take care of the patient first and we ask questions later. That's just something
Wow.
If you think about it, when we do Doctors Without Borders and we go to African countries, do we ever ask them, do y'all have insurance before?
Never.
Correct.
Never.
Right.
But remember, I started out saying we have to have this mentality here. What are we doing?
I love it.
We're the richest nation on the planet, in the Western Hemisphere, that spends how many dollars, but we're ranked, in the lowest percentile amongst our peers.
Wow.
What do we do with all that money?
Shame. And you know what? We fight wars every day. I'm telling you, don't get me started. Don't get me started.
The amputation lottery are those who are uninsured, underinsured, Medicare, Medicaid, women. Yes, those are your lottery. Yes, and then those who are older. So we need to do something to change that. That paradigm shift has to happen change that trajectory and retain them so that they can help us grow, because they are the most health conscious population are women. And so that's why I love having civic organizations and sororities involved in a lot of things, and community navigators who are mainly women, and nurses, because they get things done.
Oh, yeah. And Dr. Fakorede, we're wrapping up here. And I would be remiss if I didn't say, for all the body of work that you have produced, your work has literally saved thousands of limbs, with a T, thousands of limbs and countless lives. If someone's watching us today, watching this podcast, and, they've been putting off seeing the doctor, what's one message you'd like to really leave them with that could inspire them to take action today? What would you say that would be?
Don't wait for your symptoms. Know your numbers. If it's sugar, high blood pressure, high cholesterol, body mass index, know your numbers. Prevention is better than cure. And you want to make sure that you become informed on that. What are my options? Every heartbeat matters. Every limb matters. And one thing that I've learned is every life matters.
Yeah.
And so if you know your numbers, your life and your generation matters. That means you're doing not only what's best for you, but what's best for your loved ones around you and the next generations to come. And I think that we can change the future of cardiovascular healthcare, not only here within America, but the African diaspora and the Caribbean diaspora as well, as we continue to do good, to heal, and be humanistic and compassionate in everything we do, and be as passionate as both of you are in terms of the advocacy work you do every day on this radio station.
Absolutely.
So I really appreciate your work and your time, and thank you for the privilege of invitation.
Sure. And biggest myth you would say about heart disease? What's that? What's the biggest myth?
Biggest myth is, you know what? I ain't claiming it.
I love it.
Yeah, that's the biggest myth. And I tell our folks, listen, God, listen, you can say you don't claim it, but God has put
I ain't claiming it.
So I can lead you to the river and I can help you kind of sit, but you got to drink this. But the biggest myth is that, I'm untouchable. Or accepting the bad outcomes as the norm. Amputation is the norm because all my mom and my grandparents got amputated. That is my norm.
Yes, everybody in my family had it, so of course I'm going to have it.
So dialysis machines are the norms. No, it should not be.
Yeah.
Just because it's on every block in the Black community doesn't mean that should be the norm.
Yes.
What would you say is currently giving you hope, though? With us. What's currently giving
this right now?
Speaking harmony.
So we're going to thank you in advance, though.
Speaking harmony are hope dealers. You're dealing hope.
You.
Yes.
So how would you dealt hope to someone who has listened and has learned and will change their lives because of this hour.
Thank you.
That is what gives me hope.
Oh my God, you're speaking harmony right there.
That's what I said.
You are speaking harmony. And what's your final word, would you say? What's that final word? while you speak harmony to our guests?
I mean, final word is, continue to be the change, and whatever you do, or wherever you are, whatever circle you're, just be the change, however small, however large, however, be the positive disruptor, and continue to as my favorite,
The positive
Advocate, positive disruptor.
as my favorite congressman said, continue to get in trouble,
Good
but
trouble.
necessary trouble.
Good
trouble, but necessary trouble. Okay?
Sharon, we can't leave without bigging him up about the Nobel Prize Foundation and about your bloodlines, Mississippi. We cannot leave without you talking about that.
Well, yes, sir.
It's a documentary that I was reached out to by the Nobel Prize Foundation a couple years ago. They wanted to highlight 3 global stories regarding the Nobel Prize Foundation and the work of some of the Nobel laureates that have won awards. Diabetes won one for insulin in 1923. The procedures to do heart procedures was in 1956. Heart catheterizations, although both things are still not afforded to diabetics this year. This year when you talk about limb preservation. And so we've seen decades of lives lost and limbs lost because they're not given access to insulin or performing procedures before an amputation. So they used our story and highlighted it in a 22-minute documentary. It's been something highlighted in a lot of film festivals, won some awards, and we're hopeful that this summer or this fall, the whole world will be able to watch it
Congratulations.
for free. And so once that's
Awesome.
released, I'll release that. And in the meantime, we're just doing, a little tour, HBCUs. We're targeting HBCUs and medical schools and places where we feel that we can have huge impact. So everyone can follow me on social media at PAD Advocate, or follow me on Facebook, Cardiovascular Solutions of Central Mississippi.
Wow. Wow. Let me tell you, this is amazing. And so, Dr. Fakorede, I might add that we just have to follow the line. Follow your politicians. You vote for them. Let them work for you. You don't work for them. They work for you. They're there to serve. So you go to them. You see them. Go see the Doreen Carters of the world. Charmaine says it's very informative. Janet says, thank you, Dr. Fakorede, for what you do. When I tell you they're shouting you up, where can we see the documentary?
Yeah, so they can see the preview. They can either look up Nobel Prize Foundation or Nobel Prize Museum and put my name next to it. You'll see a 5-minute clip of it.
Yeah.
The Nobel Prize Museum is the only place in the world that you can watch this for free right now. But it's going to be released again once, Grain Media has signed off with a partner, and I cannot speak on the details yet. But that hopefully by the fall, we will have a home and everyone can watch it for free.
Thank you. Yes, I did watch the clip.
Yes.
Well,
yes.
family.
Thank you. Woo.
It is time to go.
Thank you.
Thank you so much. We've had a great time in our show.
Yes.
And we hope you viewers did too. Thank you for those who
Might be
have
back to talk
commented.
about heart disease.
Oh, well,
Hello, thank you.
that's yes,
Look,
yes.
Did you see that door? Did you see the door when I swung it open?
I did.
Okay.
Definitely coming back for that.
New Jersey Day. We have to get more New Jersey.
There you go. There you go.
All right. And you got to be able to make a trip to Atlanta so that we could give you some ice
Again,
cream.
you got to come back here.
I'm an honorary Georgian, so
I know you are. I know
We
you
saw
are.
the proclamation. Yes, we did.
I have to be in studio with you next time.
All right.
There you go. Guys, you heard it. You
Okay.
heard it here. He promised.
That's
he
right.
promised. And we're going to hold him to it.
That's right. Thank you to our guest once again, Dr. Fakorede, and to our sponsor, APAP Media Group. Big up Mr. P and Damien for producing this podcast. So, Speak Harmony family, see you next Tuesday right here on YouTube, 7 p.m. to 8 p.m. Until then, keep speaking harmony.
Absolutely. And for those of you who are going to be out there celebrating this weekend,
Oh, please be careful.
please be careful, be safe. We thank you. Please subscribe, share, like, and subscribe again, and share and like.
Share and share.
Please.
That's
right. It. We bring you valuable information. Amazing people like our Dr. Fakorede. We thank you, sir. We bless you, our brother.
Thank you. Thank you very
Thank
much.
you.
God bless.
Thank you.
Ashe.
God bless you.
Thank you. Thank you.
They talk about health, they talk about care, sharing tips, they got us without a care. Thank you for listening, you're the best. See you next week to keep the best. Together we learn, together we grow. There'll be lesson every hour, we know. See you next week with new stories to tell.